352-629-5181. That's 352-629-5181. ABC Frederick's Appliance.
Ocala's information station, 1370 WOCA. Ocala!
All right, 4 minutes after 11 o'clock. Thank you for tuning in. If you ever see the video that we made here at WOCA called A Week in the Life of WOCA, you'll see me in that video, for part of it anyway. We got video of everybody in the station.
Oh, don't we ever.
And we got a video of me sitting in my office reading a book. And the book I'm reading is called Penis Power. And the reason I held the book when the camera was on was because I thought, wouldn't this be funny if in the video, there I am reading a book called Penis Power. And of course, it was funny. Everybody got a kick out of it. The book itself is very serious, though, but it has a funny edge to it, I guess you might say. And Dr. Dudley Seth Danoff is on the phone. He is the author of that book, and he's been with us before. And we do have fun making fun of our penises, don't we, Joe?
Why do you say my name? I'm sitting here minding my own penis, and you're going there, going to throw that at me.
Dr. Danoff is a diplomat of the American Board of Urology. He served as a major in the United States Medical Corps.
Good man.
He's an attending urologic surgeon at Cedars-Sinai Medical Center in Los Angeles, and he's a fellow of the American College of Surgeons, and it goes on and on and on. His book is a bestseller, by the way.
You're lucky he didn't hang up on you after that one.
His book is called, he knows me. He's been with us. Penis Power, the Ultimate Guide to Male Sexual Health. Good morning, doctor. Did I lose you?
No, he's still blinking.
How come I don't hear him?
It's blinking. You got to press him on. Got to connect with
Doctor, are you there?
Yeah, I was. We got cut off.
I don't know how that happened. Okay. Well, we just gave you a pretty nice intro. I hope you heard it. We were having fun with the title. But anyway, thank you for being with us today.
Always a pleasure, Larry.
Yeah. Are you in L.A. right now?
I am.
Okay. Well, thank you for getting up early.
Good morning, yeah.
To be on the air with us here. Did you hear the intro at all? Because I want to bring
I didn't.
Okay.
No,
well,
I didn't. I was cut off.
Okay. Well, what I basically said, I'll do it real quickly. We made a video, and in the video, this is last year or so.
Yes.
Why are you making?
Why am I frowning?
He's
going to hang up on you.
No. I'm holding your book. When they do a video, when we did a video of the whole station, kind of it was called A Week in the Life of WOCA, and I said, well, when the camera's on me, I want to be holding the book called Penis Power. And I did it to get a laugh, just because of that. But is that a problem with us? Do we consider our penises funny?
I don't.
No, I'm a mainstream urologist. I went to Princeton, Yale, Columbia.
Yeah.
I've been in practice for nearly 40 years. Penis Power, I've gotten a lot of negative feedback from the media because of the word penis.
Right.
I keep saying, it's not a pejorative word. It's a body part. It's like an elbow, like a stomach to a gastroenterologist. Let's get over it.
Right.
I'm going to go on television. The author of Penis Power, our favorite Beverly Hills urologist. Ha, ha, ha. A lot of giggles. Come on.
Yeah.
Grow up. It's the 21st century here.
We never grow up, do we?
Never grow up.
But meanwhile, whenever I mean, sex is a hugely important part of our lives, right?
Absolutely.
Or it was.
Oh no, it still is.
Speak for myself.
And we all know, penocentric is what I say in the book. We just think about that thing all day long and nothing else.
Oh no! Now, but women have no problem. I mean, they take care of their private parts and talk about it on commercials freely, no problem, and nobody giggles. Well, except for the vagina monologues, they giggle about that.
Well, I mean, it was a big hit on Broadway, worldwide. Everybody saw it,
Yeah.
Oh, so are we looking at a Broadway play now for this book?
The book is the subtitle, "The Ultimate Guide to Male Sexual Health." Is there anything that is there anything that's taboo anymore regarding this, or have we gotten past all of that, other than the word penis?
Sadly.
Go ahead, Doctor. Doctor, are you there?
Doc, are you there?
Yeah,
Go for it. We're listening.
Okay, someone's cutting him off, or I'm not really sure what's going on there. Doctor, you're breaking up a lot. Are you still there? Doctor?
Yeah, I don't know where he is.
I don't know what to do. It sounds like he's on there. I mean, it looks like he's on there.
Doc, are you there, Doctor?
No, he's not there.
Okay.
I don't know what happened there. But anyway, so there you go.
We'll try again. He's calling back in right now.
Doctor, I don't know what's going on, but you're back on now. Thank you for calling back.
Yeah, I'm so sorry. I'm speaking on my cell phone because I'm in an odd area. But if we get cut off again, call me at 310-274-0193. I just can't make a call out from that number.
All right, tell me it again. 310
274-0193.
2740.
Got it.
You got it? Okay.
274-0193 if we get cut off. Or if this
That's
is a
all right. If we don't, one of our listeners might call you now.
All of our listeners will be calling you now. All right. So let's talk about the serious aspect of this. Obviously, you've written a serious book, but we giggle over the title, right?
Absolutely. This is a mainstream medical book, easy to understand, covers lots of subjects. It's written for the layman, nothing complicated about it. Of course, I do a lot of it tongue-in-cheek. I try to laugh at my own organ.
Oh, yeah, you just said layman. Yeah, I heard that.
So what is your thought on the aging of men and how that area changes for us as we get older, but yet we try to keep it young with pills?
Well, look, it takes me all night long, what I used to do all night long. There's no question about it. So a man can be healthy, get a good erection, as long as he can get out of bed and brush his teeth, essentially forever. And I have patients certainly in the 8th and 9th decade that are still having sex, and able to get an erection firm enough to penetrate. I mean, the drugs, the magic pills, Viagra, Cialis, Levitra, that's all helped the aging male. So they've been great for the men, and the women are scratching their heads about that one.
And women often say they want something similar for themselves, and is there something for them?
Well, if you think of female anatomy, and if you think of the clitoris as a small-sized penis except without a hole in it, the same pills will work for ladies. So the magic pill, Viagra, Cialis.
Oh, really?
Small dose for a lady is very workable.
Did you know that,
doable.
Now I do.
You always learn something from your urologist.
That's it, yeah.
So what about the whole testosterone thing? That's kind of a side subject, but is there any benefit to having testosterone supplements?
Only if you have a low testosterone, Larry, because if you give normal men who have normal testosterone, exogenous testosterone, all they do is shrink their testes.
Say what?
Yeah, absolutely.
You don't grow more hair then?
Oh, you would think it'd go the other way.
Yeah, what happens is the testicle recognizes that there's an increase in circulating testosterone, and they just shut off producing testosterone. So you've got these bodybuilders, these men with huge muscles and biceps and teeny testes. I've got a few famous Hollywood types, muscle guys that have testes of a 4-year-old.
Really? Can you name names?
No. Don't do that.
No,
you want to get me in trouble.
You can't do that. I'm in trouble enough.
So do they come to you? So do they come to you for help with that? Do they say, "Hey, doctor, what's going on?"
Yeah, but unfortunately, little can be done. Now, in terms of exogenous testosterone, or what's called TRT, testosterone replacement therapy, we give that to men who are what we call hypogonadal, meaning their serum circulating testosterone is low. And in that setting, giving testosterone is a good thing. It increases energy, you lose your pot belly, your mood elevates, you stop being a grouchy old man. So TRT is certainly useful and allowable, but a man has to have a low serum testosterone to do that.
So all the big beer drinkers out there with the big bellies, forget about it. Your testosterone is up there, but you don't take TRT.
Yeah, and you also got to stop drinking so much beer. So when you take a shower, you'll get your testicles wet.
Okay. I want to ask you a question about size because this comes up all the time. Here's my observation, and maybe I'm not just watching the right shows. But if you have like a serious discussion where people are, I'm going to be serious and diplomatic, and I'm going to be academic, they will always say size doesn't matter. Women will always say absolutely, I couldn't care less about size. You get to a party where women are just giggling, and it matters. All of a sudden, you hear the truth. What do you think about this?
Well, penis size is like any other thing. It's a bell-shaped curve, so there's some guys on the tiny end and some guys on the ginormous end, and most of us sort of in the middle. I've seen more penises than can fill a Rose Bowl. I've spoken to the women attached to those penises. Not once ever, Larry, did a woman say to me, Dr. Danoff, could you make my man's penis longer, fatter, wider? What they have said is, can you make it a little firmer, attach it to a sweeter guy, and give him a Platinum American Express card? All the action is at the tip, and you can't make it larger. Woe be to the man that wants to have his penis enlarged. It surgically can't be done. Believe me, if it could, I'd be retired on an island in the South Pacific with the babes, but It can't be done.
Doctor, I want to tell you a story that I heard from a guy I knew who was circumcised as an adult. He got circumcised as an adult, and I don't know why, but he told me afterwards, he said, never do this. He said, because sex is not as good anymore. Is that true?
Most men who I circumcised as adults have problematic foreskins, non-retractable foreskins, infection. So at least in my experience, I don't think that's true. I mean, there's a lot of Jewish men, a lot of Muslim men that are walking around the world, who are circumcised.
But they don't know any different.
Well, I don't hear any of them complaining about it.
Me too. I'll tell you. I mean, I don't know any different.
My children.
Are you circumcised?
I am.
Okay. Well, so am I.
I had no choice. I had no choice.
Me too. But I don't know. But this guy knew different. He knew different. He went most of his life as an uncircumcised man, thinking he had to get it for some reason. Got the procedure done, and I'm going to tell you exactly what he told me. He said he can't last as long.
Well, I just don't think there's any medical reason for that, because the reality is in most normal men who are uncircumcised, when the penis is erect, somebody looking at that erect penis cannot tell whether it's circumcised or not, because the foreskin completely retracts. So I don't know of any scientific basis or urologic medical basis for his explanation, but hey, feeling is feeling, it's psychological. There's a lot of stuff that goes into making an erection and how long it lasts and how satisfying you are. So a lot of factors there.
How much is that is mental?
Yeah, a lot, sure. A lot of what we think about penis power is 99% between your ears and 1% between your legs.
Yeah, probably true. Yeah, makes sense. All right, we do have the phone ringing, so let me answer some calls if you're okay with that.
I'm okay with that.
Okay, Dr. Dudley, Seth Danoff, again, is our guest. He's written the book Penis Power. He's out in L.A., got up early to do this interview. The book is a serious book, although we giggle at the title, and it does have some funny illustrations in it, by the way. The Ultimate Guide to Male Sexual Health is the subtitle. Good morning. Thank you for being patient and for calling. You're on the air with Dr. Danoff.
Yes, good morning, doctor.
Good morning.
Other than having maybe a really good dream, why do most men usually wake up in the morning with a partial erection?
That's a very good question, and obviously it's very common. It has partly to do with most men wake up in the morning with a full bladder, and that puts the pressure on the veins that drain from the penis. So it impedes venous return from the penis. So blood goes into the penis arterially, and then it gets stuck there by the full bladder pushing down on the veins and impeding venous return or venous outflow. So that's the reason most men get AM erections, morning erections.
Wow.
Okay, thank you.
You're welcome.
Well, that might be the solution to the problem then. Just wait till the morning. Everything will be fixed.
Well, A lot of people say it's better in the morning. It's a great way to start the day.
So talk about the prostate a little bit. Obviously, this is probably the most serious part of what you do because that's the part that becomes cancerous, although other parts get... what was... the bicycle rider from Tour de France, he had testicular cancer, remember?
Yeah, that's unusual. And what's his name? Lance Armstrong
Thank you.
had
Yeah.
metastatic testicular cancer to his brain.
Oh my
And
goodness.
he was treated, and then went on to win 7 cycling Tour de France, questionable, but still.
But he was taking drugs. Is it
Yeah,
possible?
but I mean, so is everybody else. on the
Okay,
Tour-
all right.
on the
I
Tour de
didn't.
France,
I didn't know if there was a connection there.
Yeah.
So talk about the prostate, because if your bladder is filled and they say you're getting up all night long, right? With the
Well, one
yeah.
of the signs of benign enlargement of the prostate is it pushes up on the bladder, decreases the effective capacity, so it makes you urinate more frequently. But a more serious problem, obviously, is prostate cancer. I mean,
Yeah.
Larry, 240,000 men will be diagnosed in the United States this coming year with prostate cancer. And it is not the bacia morte, the kiss of death. I mean, we have ways of treating prostate cancer primarily with the robot, the Da Vinci robot system, where we do an operation that spares the nerves, it preserves potency, it preserves continence, and it's a walk in the park. So the key is early diagnosis, proper treatment. Lots of ways to treat prostate cancer, including watchful waiting or active surveillance, in which case we don't do very much. It's an innocuous cancer. So men need to get a yearly checkup.
Yearly?
Over the age of 40. Yeah, absolutely. Over the age of 40. And if there's a family history, meaning one member of your family, a male member, has prostate cancer, you're 30% more likely to get prostate cancer than the average guy.
Now, when you say yearly checkup, how intense?
It requires a digital rectal examination,
Okay.
test of the blood test PSA.
Okay.
Or we have another blood test called the HPI, the Prostate Health Index. So those are blood screening tests. A digital rectal exam is an examination with a gloved finger,
Right,
slightly
right.
uncomfortable, both for the patient and the doctor, I might add.
Yeah.
and another. But those are the ways that you diagnose early cancer.
Thank you for adding that in.
yeah. Now we know.
But now the other one, I call it the kaleidoscope for fun. But how many times every 3 years after a certain age?
Well, again, that's the province of the colorectal, so the colonoscopy.
Right.
So I mean, my doctor tells me to do it every 5 years. But again, if you have a family history of colon cancer, should be more often. But that's not a urologic problem. Next door neighbor, but not a urologic problem.
Okay.
Dr. Danoff, we have, it seems like, been focusing mostly on older men's issues. I want to go to the younger men just for a second, because in the book, you talk about something younger men might be interested in, and maybe all men, not just younger men, but it's called the Valsalva maneuver.
Yes.
Explain what that is, how you do it, and why you would need to do it.
Okay, so what we're talking about here is premature ejaculation. In other words, ejaculating before you either want to or it surprises you.
Which is a young
One
man's
of the
problem,
way-
right? That's a young man's problem.
More a young man's problem than an older man's problem. Absolutely.
Okay.
And one of the maneuvers to sort of retard ejaculation is what we call a Valsalva maneuver, and it means before you reach the stage of ejaculatory inevitability, then it becomes a reflex and you can't do anything about it.
Right.
What you have to do is bear down, increase your intra-abdominal pressure, sort of the feeling like you want to take a bowel movement but don't have a bowel movement.
Gotcha.
So it's bearing down.
Oh my
That's
goodness.
not considered good form if you do that.
From the point of no return. Got you. Yeah.
Right.
That's not good form. That's good.
Yeah. But that's that is what a Valsalva
And what does it do? What physically? Well, how does that stop anything?
It creates pressure on the vas deferens and squeezes the seminal vesicles and just prevents them from contracting.
Yeah, it's like you're being
And
constipated.
delays
Like, okay, oh no, I'm doing this. I can't do that. Kind of thing.
Goodness.
Wow. Our bodies are so complicated, but yet so simple at sometimes.
You do talk about some of the things we are as men. Let's face it, influenced sometimes in ways that women don't like. In other words, we may be influenced by the things we read in a man's magazine or by pornography or things like that. Women really don't want most of that stuff, right? What do you do cover this in the book? You talk about what women need to know. There's a whole part in here for women. Go ahead.
Yeah, because I want a woman to be a penis professor. I mean, I want her to know everything about the penis in her life. You know, when, how, where, what, it excites it. So, yeah, women have to be very attentive to their man's penis. And I don't mean that in any pejorative, way. I have a lawyer for a daughter and a very strong, long-standing wife, so I respect their needs. But I think it makes for a better relationship if a woman is a penis professor.
Penis professor.
And I think,
that's a title. Yeah. Yeah, I guess so.
Yeah. I guess it's. Is it important for women to know? Well, how important is sex for a woman, and is it important for them to know how important it is for us?
I cannot speak for the women. I'm not a women doctor. I am a man's doctor. I could tell you that it's very important for men. I have patients well into their 90s who are feeble and say, Doc, I'm dreaming. Doc, I'm dreaming. I just want to get it up and in again. I mean, guys broken, one foot on a banana peel and the other on an icy slope. They're still dreaming about sex.
Okay. So you're saying their sex drive is too high. They want it lower. That's what you're saying?
Yeah, right. From their brain to their between their legs. Mm-hmm. They want to lower their sex drive. But men think about it all the time. My sense is that women are less sexual as they get older, especially postmenopausal women. And I'm not speaking for all women, but there's no such abrupt. There's andropause in men in which there's a gradual diminution in circulating testosterone, so the libido goes down. But in very few men does the testosterone go to zero. So even as men age, they still got that drive, that testosterone level, which drives the libido.
It's just on a lower gear. Okay, yeah.
What about What about the health of the sperm themselves? You always hear that a woman has a biological clock and she can't have babies after a certain age because the eggs are going to be no good. Does the same thing happen?
A menopausal woman produces no eggs. An older man produces less sperm, and each time he ejaculates, the volume is less, and the time between his ejaculations increases. But like a tadpole, it only takes one good swimmer.
That's what I was just going to ask you. Okay,
sure, it's got a good
looks like a tadpole
body.
Too.
Yeah, sure. Under the microscope, it's got to have a lean body. It's got to have a tail. It's got to be swimming, upstream. So it only takes one. That's different for
less competition as they get older.
Doctor, did you see the story the other day that they have discovered? Archaeologists have discovered the world's largest sperm.
I did not see the story. No, Larry.
Google it. I'm not making this up. Google it. They said it looked like angel hair pasta, and they think it. You could see it without a microscope, and they think it came from shrimp, which I'm having a hard time with. Why would shrimp have gigantic sperm? But
I don't know. Why do we call them shrimp?
Oh, good.
How could you have a big one if your name is shrimp?
Well, this is prehistoric shrimp we're talking here. Yeah.
Yeah, this is like millions of years old. I don't know how big they were back then.
But boy, the suppers were good back then.
I promise you, if you Google it, it's just a story that's earlier this week. Doctor, you're always fun. You're always fun to chat with. The book has obviously some serious good information, psychological as well as physical. The book is called Penis Power. I have a copy of it right here. When you come, you have to ask for it by name. No, I'm teasing. Just tell us your name, and it'll be waiting for you. The rest of us have to go by. You do have a website, right, Doctor?
I do. penispowerbook.com. It's available on Amazon. The book is in all your booksellers, and we're having a lot of fun selling it and signing it.
I bet you are, yeah. Penispowerbook.com. I have a copy right here. Again, if you want it, call me. The rest of us have to go buy it. And you can probably, is it an ebook as well? That's probably less embarrassing.
Yeah, it's an ebook as well. And if you're any of your listeners in LA, just call me and come on up to my office at Cedar-Sinai Medical Center and say hello to me.
All right.
Outstanding.
Doctor, thank you again for being on the air with us, and have a great weekend.
Always a pleasure, Larry. You're welcome.
All right. We will take a little break, and we'll be right back. Fun with Joe in about 10 minutes.
Habitat for Humanity of Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity Ocala Restore at 926 Northwest 27th Avenue. To schedule a donation, give us a call at 401-0075 and we'll come pick it up. For more information, visit ocalarestore.org. Habitat for Humanity of Marion County. Building homes, building hope, building community.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville.